For 4 months now, Wajir County in northeastern Kenya has been battling a cholera outbreak, a disease that is highly contagious and is spreading rapidly in rural communities with an average of 15 admissions every day. One by one, they are brought here to the Cholera Treatment Center, an isolated ward at the Wajir Referral Hospital, where they receive specialized treatment. Mahmoud Ahmed, a former pastoralist, says he is lucky to be alive. He was found unconscious after a night of severe vomiting and diarrhea.
Ugonjwa nilianza Jumamosi na bita kama tumbo inashikwa, nikakuja hospitali kanipatia ORS na dawa nyingine ya kusaidia ambaye ni round nyeupe. Sasa nilipotuma hiyo dawa kwanza inajinja mimi tumbo, 24 hours inatumiwa moja.
Cholera is a dangerous disease, easily transmitted through contaminated food or water. Without treatment, death can occur within 3 to 4 hours. Since the first case was reported in Wajir East Sub-County in July 2015, various cholera intervention mechanisms have been put in place by the Ministry of Health and its partners. However, the cases are increasing every day. So far, 23 people have been confirmed dead. 1,710 cases are being treated at the cholera treatment centers established in 6 affected sub-counties.
Wajir doesn't have a proper sewerage system. And as I think the world knows that these are the few places where bucket latrine is still being used because of the high water table. So the water gets contaminated very easily, and the county is now looking forward to come up with a proper sanitation way, because it's evident that our water, which was tested, has shown so much coliforms and other contaminations.
Despite these drawbacks, the Ministry of Health, with support from ECHO, UNICEF, the Red Cross, Médecins Sans Frontières, and other local partners, responded in a timely manner to control the spread of the disease outbreak. There has been mass chlorination of the water supply and distribution of water purifiers. Food control measures in market centres have been introduced, as well as case tracking. Through the Health Promotion Unit, community health workers have been engaged to sensitize communities on health education, especially home hygiene and sanitation. But social and behavior change in people takes time, even in critical times such as these.
Unajua hiyo kuchukua hiyo mawaidha, watu sio sawa. Wenye ukimwambia sahi wanachukua hiyo mawaidha on the spot, na wengine at least ukirudia for 3 days, 4 days unachukua hiyo mawaidha ndo wafanye hiyo Kenya wameambia.
Bawako village is one of the most affected villages in Wajir, with more than 60% of the cases. This outbreak is exacerbated by poor hygiene and sanitation practices, including open defecation and use of contaminated shallow wells. Fatuma Abdi has just returned from the cholera treatment center in the Wajir Referral Hospital. Her last-born son was also infected. She regrets that she did not follow the advice of the community health workers who visited her house before she became sick. All is not lost in Wajir. The community health workers and volunteers are committed to go to every household to ensure that they understand the threat this disease poses. In a gathering like this one, they create awareness and use banners to teach cholera preventive measures, how to dispose human waste, the correct way of washing hands, and water purification. This exercise has to be repeated many times for people to see the life-saving importance of these practices.
We give health education to the community. There's also the local radio FM that we use, Wajir Community Radio. We have both the live show which we go there every Tuesday, 1 hour, and we air what is cholera and everything about cholera. We go back to the community and now we do the demonstration, how to wash their hands, the steps in hand washing. Those are the demos that we demonstrate. The use of aquatap, how are they going to use these aquataps, after how many minutes. The other thing that we use is religious leaders. They are the key people in the community. They are the decision maker. They are the gatekeepers of the community. So we felt that through them, we can also give the information to the community.
musqusha marka laga soo baxaa in gacmaha la dhaqdo hata islaamka ahadiisu waxay dhigahayaan hadaadan saabuun marka la sheegin marka musqusha laga soo baxay jeermiska gacanta intii dhulka carrada saa lagu dhaho in gacanta carrada lagu ruuqo oo laga dhaqo.
To date, about 1,800 households have been reached with information, education and communication, and there are plans to reach more depending on the availability of resources.
We have received a lot of support from the county government, but as the outbreak continues, as the days continue, the support is dwindling. And so we have challenges in terms of resources, from health workers to financial resources. Although a lot of staffs have been recruited in the beginning of the outbreak, but there's burnout. People are tired. The outbreak has been there for long.
Wajir County has a unique sanitation problem, and the presence of risk factors for cholera and other communicable diseases are prevalent. A long-term strategy is required to empower communities to create a disease-free environment where people can access clean water, food items and sanitation, and stamp out cholera for good.